The most rewarding part of my job is working with the patients, with their parents, and also with the physician. We have a great relationship. We get to know our patients, and it's a nice thing that they know you by your name and that they're satisfied with their care. If I have a friend or a neighbor's family member that needs to have orthopedic care, pediatric orthopedic care, I would definitely have them come to OrthoCarolina. We have easy access, we have a lot of offices and hours, and I would definitely tell them to come see us.
The staff here is just, everyone pitches in, and there's so much teamwork. And we all just kind of mesh and get along so well that it makes work fun. The most rewarding part of my job is just, you know, when the kids come in and they get the cast off, and then it's like, boom, I'm free, I can do it, and look, thank you for healing my bone. You know, they'll call us bone menders, you know. That's just, it's fun.
I don't work with people, I work with family. We're like a family in pediatrics. I think most departments envy us because we're like a family and everybody can see that. Like, we don't have any drama and everybody's like sisters and brothers, even to the doctors. Like, they treat us like their children or like sisters and brothers. We're no different. Everybody is the same. I love the interaction with my kids because most of my parents are parents that call on the regular. So like, I get to know who their parents are. Most of the time when they call it, hey Tonya, this is such and such, and I don't even need to ask for the date of birth because I already know the child's name.
I think that we all get along really well. We have a pediatric retreat every year, which helps us kind of get to know each other more. We talk to the doctors, they show us PowerPoints on things that they do, and that whole connection and, you know, keeping us involved with the doctors and the managers, it makes us all feel like we're all working as a team instead of little separate departments on each floor. And I like the fact that everybody stays connected and we all know what we do.
My role here mainly is to continue to inspire my staff every day to provide the best care that they can for every patient that walks in the door on an individual basis. We're very lucky here to have a team whose main and common goal is to provide excellent service to the patients. Accidents happen every day for kids, and when you have a full schedule, you're like, okay, how do I get this child in without them having to wait for an extended period of time or having to overbook the physician's schedule? So every day we work on better ways to make sure we serve the community and get those emergent patients in.
The thing I like best about working at OrthoCarolina compared to other places I've been, they really emphasize on patient care. I think the way you treat the patients, you know, is reflective on how you feel at work, and I like the teamwork here, like my partners that I work with in pediatric clinics, so that reflects on our patients, and our patient impact reports are great. So that's what I like about working at OrthoCarolina.
I drive in about 45 minutes to get here, and people say, why don't you find a job closer to home? But I truly want to be somewhere where I'm proud to say where I work.
The most rewarding part of my job is just knowing that at the end of the day that I'm able to help out as much patient as I can, to either from working them into an appointment or trying to get them to the right appropriate department or to the nurse to get their answers, or just to help out the patients that call in every day.
I think OrthoCarolina is different because I think nobody's here that doesn't want to be here. I think that we care about what we do, and you know, we all have a passion about our patients and making them better. The best part of my job is just the funny things that kids say day to day, the hugs, the kisses, the graduating from I'm in a cast and I get out of my cast.
I think what could help a patient that might be nervous about meeting a new doctor for the first time, or, you know, with a new problem, new orthopedic problem or an issue, that type of thing, is that everybody's on their side. Everybody here is here for that patient.
I've been here for a long time, so I've met a lot of our pediatric patients and fallen in love with a lot of them. And I love it when they come in and maybe I haven't seen them for 6 months, and the first thing they do is say, "Hi, Cindy," and they come up and give me a great big hug. And that's just the most perfect part of my day.
Well, if I think about special experiences, I think they're almost too numerous to start picking out one in particular. I think most special to me probably is our special needs population. I think In a surgical subspecialty, it's oftentimes hard to establish relationships where you meet families from day one and follow them through their lives. But with our special needs populations, oftentimes we meet them in the first weeks of their life and we follow them to their adults. And so that, I think, is very unique to the Pediatric Center.
If I have a parent that has a child with a condition, first and foremost, we want them to feel that they're in the best place possible for their child to get care. When their child comes to OrthoCarolina, we feel that we offer them a great team, everyone from our front desk staff, right down through our x-ray techs, right down through the providers and the clinical support. We want that parent to feel comfortable. We want them to feel educated on their condition. We want them to feel like they're included in the treatment decisions, and we want them to leave here feeling like they're in the best place for their child.